I'll give the call to member for Warringah.
Thank you, Madam Deputy Speaker. Well, first of all, I would like to start by thanking the people of Warringah and the Northern Beaches for their amazing hard work and sacrifice in holding the outbreak that broke out around Christmas time at bay and in check so quickly. But I do acknowledge how hard that was and the sacrifice that came, especially for our local businesses, and do continue to advocate for better support for those businesses. But this was necessary. I was so incredibly proud of the level of testing and the level of compliance and how hard everyone in the Northern Beaches and Warringah really got down to keeping that outbreak in check. And I would also like to thank the Health Minister for responding to my calls, to liaising with me in relation to having more testing centres. I think that was clearly translated into high testing rates, and being able to work together on issues of concerns as they came up in the community. But I'd like to speak on the Australian Immunisation Register Amendment Reporting Bill 2020. This is really important legislation at this turning point in Australia in dealing with the health crisis of COVID. The main point of the bill is to create a requirement for recognised vaccination providers to report to the Australian Immunisation Register information relating to vaccinations they administer and vaccines they are notified about that were given outside Australia. It's vital that we know who has been vaccinated, especially in circumstances of limited availability of vaccines, as we are seeing emerge globally in response to COVID-19. Currently, there's no statutory mechanism by which the Commonwealth can require vaccination providers to report vaccines administered. So vaccination providers are encouraged at the moment to report all vaccines administered to the AIR. However, as reporting is voluntary, not all vaccine administered are reported, and this may be it is really important that this legislation amend that situation. Reporting to the AIR is maintained at high levels, and the data is entered is sufficiently reliable for the administration of childhood immunisations due to a number of existing policy and program settings which encourage reporting. I know it's been some years, but I'm of the generation with the Blue Book for our children and the regular trips for immunisation. But it has seen the drop of so many illnesses and the protection of our children, so it really does reinforce how lucky we are in Australia to have such a strong vaccination program. But records of vaccinations for teenagers and adults are less reliable, and that is where it becomes so crucial for COVID. Given the significant cost of public vaccinations, improving the record keeping it by mandating reporting of vaccinations is both medically and financially prudent. So this bill will introduce a requirement for those who administer vaccinations that they report those vaccinations for COVID-19 and influenza vaccines from 1 March 2021 and for all other national immunisation programs from 1 July this year. This bill will introduce civil penalties for providers of vaccines who don't comply with reporting requirements. It is so important that we have a high uptake of the vaccine. Last month, I conducted a public online event with one of my esteemed constituents of Warringah, Professor Mary Louise McLaws. She's a Professor of Epidemiology, Healthcare Infection and Infectious Disease Controls at the University of New South Wales, and she stressed very clearly the importance of a high uptake of vaccination in the population. These vaccines are not 100% foolproof. They require a high level of uptake so that we absolutely multiply and maximise their benefit. It is concerning. Yesterday, Newspoll released a poll that showed that there was about 75% in support of getting the vaccine or who planned to get the vaccine, but it did still leave 25% of those questioned who indicated they would not. So it's very important. So it's clear messaging matters. We need to influence that 25%. The data indicated by the government that the goal was to vaccinate 80% at least of Australians, which means we do need to influence that 25%. So facts matter, and it's important that as parliamentarians that we provide the right information to our constituents I urge the people of Warringah, if you have any concerns about the vaccine, go to your health professionals, get professional health professionals' advice in respect to it. That was something that Professor Mary Louise McLaws stressed very clearly. And it is really important that people turn to their health professionals for that information. There's been a raging debate about members of the backbench disseminating false information. I can only say I would reiterate my call that there should be a higher professional standard for members of Parliament, that information and facts matter. We saw that in the aftermath of the US election and how far misinformation can lead people. And from that sense, I think whilst I support freedom of speech comes with responsibility. And so it is important that facts matter. Thank you.